So this is an introduction to the Kinesiology 231, Fitness Assessment and Programming. We're going to look at a couple principles of fitness assessment, what we're looking at, and what we're actually trying to do. So the first question is, what is health? And we look at, in the industry, we're looking at health and wellness. And the next question is what is wellness? Now, these are words that we normally use on a regular basis, and we assume we know what they are. But there are two distinct things between health and wellness, and it determines what someone might be pursuing in terms of a fitness goal or a health goal. So when we look at these definitions, one of the big things is when you look at health versus wellness is health can be viewed as more of a passive aspect. This is the overall condition, so their physiological state of their mind and body, and whether disease states are there, so whether the absence of illness or injury. And this is based on factors that could be beyond your control. Genetics, as we age, we start to have lower stress tolerance, and then family history. The genes, that's always kind of a scapegoat, if you will, for many paradoxes that exist. So like why there's a recommendation to follow a low-fat diet, but then they'll find that areas that have high fat intake actually fare better. And so genetics tend to get that, it's in their genes type aspect. We'll talk about genetics throughout the semester, but genes really account for about 24% of someone's health outcomes. So although it is a factor, it's not a big factor. How someone responds, the lifestyle choices they make, the type of training they endure, these have bigger impacts. And just because someone has a genetic predisposition for something doesn't necessarily mean that's going to express itself. So the genes still have to be expressed. What it might mean is that genetics might have someone with, let's say, quote unquote, poor genetics might not be able to tolerate as much as someone that has good genetics, but doesn't mean that someone with good genetics is always going to be better than someone with bad genetics. The other definition here is wellness, and these look more at the, instead of passive, more active. So these are the choices or decisions that are being made on the way you live. These tend to multiply on each other. So you do one and then it works synergistically with another one. So instead of 1 + 1 = 2, 1 + 1 ends equaling 3. And you start to move towards that direction of optimal wellness. The default is optimal health. Whereas if you just focus on health, that may or may not include wellness. I don't need to sell it to you guys, but there is a relationship between death and health, obviously, but the better you take care of yourself, the longer you're going to live. And that's looking at the quantity aspect, but really we're in the day and age we're living in, the quality of that life is also very important. So there's no, in my mind, or my opinion, there is no point in living to 90 or 100 years old and you are bound to a bed. I'd rather make it until 70 or 80 and I'm still kicking ass and taking names at that point. So there's a big debate. A lot of cultures and countries have different perspectives of this quantity versus quality, but you participate in higher risk type behavior, both choices you make, what you put into your body, mind states and other aspects, or physical inactivity. These can be a detriment and accelerant, if you will, to early death and disease. So the biggest problem that we face besides quality of food is the sedentary lifestyle. And it's not because people are choosing this, it's because our lifestyles tend to that, right? We have public transportation, we don't have to do a lot of manual labor, we do a lot of sitting, and as we'll talk in posture and aspect, that sitting is probably one of the worst things that you can do. But this lack of physical activity, which we'll get into detail, that can let opportunity for dysfunction and diseases set in. Whereas like an active lifestyle, it's not so much that the activity itself is beneficial. In fact, the activity itself, as we'll talk about in a later lecture, is a stress. So it's actually a negative thing to the body. It's the fact that it tempers the body. It hardens it for the future. And you are creating this physiological, psychological, and emotional challenge, and it's building fortitude, both physically, mentally, and psychologically, and it's making you tougher, not just for the tasks that you want to do, but for the tasks that you might not expect, like a tumble down the stairs or an exposure to a virus. So that's why we look at a lot of these risk factors that come into play with like disease states, the more functional, the healthier you are, the better off you're going to be. It's not because a virus cares how much you can squat or bench press. It's the fact that you can squat and bench press 2 times your body weight or 1.5 times your body weight. The physiology and the metabolic powerhouses that drive that also lead to better health outcomes. So it really gets to this improved quality of life as well. So the opposite of sedentary or active lifestyle is sedentary, and we usually tend to associate it with images that look like this, right? And we are quick to shame, and we say that this is just laziness or a result of inactivity or overconsumption. And that's the one thing that you're going to find through this course and through your whole physiology journey is that there's never a right, clear answer, right? There's never a simple answer. And there's no black or white. It's a very much gray area. And it's not as simple as just eat less, do more, and voila, you're going to be lean and fit. If it was really that easy, we would all be that. But there are many factors that come into play. And when we get into the fat loss versus weight loss, and we look at like true fat loss, not just weight loss, we'll look at the multitude of factors that come into play for why someone tends to store body fat here or here. So, obesity is not too much fat. It is an ongoing process. And there's a saying in the fitness perspective is that you don't lose weight to get healthy, is that you get healthy and then you end up losing weight. It's a byproduct. So this obesity aspect is a process. It's a inflammatory component. There's other aspects. If I were to if I threw this guy on the table and we did liposuction on him, we took 3 gallons of fat off of him, probably more, 3 5-gallon bucks, 15, whatever, he would still have the same metabolic risk factors of diabetes and cancer because it wasn't the excess weight that was the problem. It was the lifestyle choices that led to this, and maybe not the lifestyle choices as well, but also the environmental components that he's being exposed to or the mental aspect that he's being exposed to. So it's a multifaceted, complex process. So these are all the benefits that physical activity can remedy. So when we look at the number 3 killers in the United States, cancer, cardiovascular disease, and metabolic disorders, some level of sedentary, low tolerance, basically being weak, has led to these opportunistic degenerative type components. Musculoskeletal disorders, low back pain from not being able to tolerate the loads it's being exposed to, a whole slew of research looking at the psychological benefits of fitness and physical activity. And then these are, when I look at my role in the physical therapy field, and we're doing a health history intake, 1 out of 3 people have diabetes, pulmonary. It's like you at least all of our patients have like 50%. If you're over the age of 65, I'd be surprised if not one of those are there. So it's pervasive in our field, in our industry, in our society, that these components are there. There's this big move by the American College of Sports Medicine that looks at this aspect that exercise is medicine. So it's not what great drug can we take for this, or what drugs can we take for this, or what we can do for that. What lifestyle choices are we doing? What physical activity and exercise are you doing that combats metabolic disorders? And I pick metabolic disorders specifically because diabetes is one of the most destructive disease states here, and it is the one disease that is 100% curable, type 2 diabetes. And it has to do with metabolic regulation. So like I was saying, disease is opportunistic. There are some freaky and scary viruses out there that affect the weak and strong, but most of the diseases above here, like in this aspect, those are opportunistic. These are things that settle in because of degenerative aspect. These aren't caused from viruses or bacteria. These are caused from breakdown of our tissues. And the question you always want to ask yourself is, what is your tolerance? How much can your body handle? And it's not just how much can you handle physically. Your physical tolerance carries over into your physiological tolerance, and that carries over into your psychological tolerance and your emotional tolerance. And it all shares resources. Inflammation is the baseline for most of these components, And exercise is a pro-inflammatory type aspect that forces you to have to come up with your own anti-inflammatory mechanisms, and it trains it. So you're not just training to run a marathon or training to get stronger in your bench press. You're teaching your body how to become irritated, recuperate from that, and recover from that. And when you don't do that, especially if we stay in like nice posh environments of 70 degrees year round and soft environments, you never have that opportunity to grow from that. So what it comes back down to is, what's your threshold? What's your tolerance? And that's what you want to be thinking about for your own training and for your clients. So you can read through this list of the benefits of physical activity. It's basically the fountain of youth, right? So look better, feel better, live longer, and don't die. I mean, that's really, what else can you ask for? So how do we do this? That's the question, right? And again, I've already alluded to that it's not as simple as just eat less and do more, although that is part of the equation at some point and in some aspect. But the before we answer this, how we do this, it's always the just work out, just get off your ass and do it, just do it. It's the popular, we'll wait until January 1st, buy some equipment, go to the gym, or for you guys that were going to the gym, January 1st to the first week of January sucks, right? Because everyone's there, New Year's resolution. And in about 6 weeks, 10 weeks, 12 weeks, it all clears out, right? Because no one's able to stick to the program because they didn't have the mental fortitude to adjust those changes, or they got hurt because they were doing too much too soon. A whole host of reasons why we don't adhere to our programs. But before we get into this aspect is, let's define some aspects, because this word physical activity gets used a lot. And this whole like get up and move, park in the furthest part of the parking lot, use the stairs instead of the elevator. These are all great things, but they do absolutely nothing. Nothing. All you're doing when you do physical activity, it's bodily movement. It's you're using the resources you already have. It's doing nothing to challenge the system. It's doing nothing to elicit the change. So we have this big move, which I think is applauded. It's great. We need to get up and move more, but it starts there, but never really goes any further. And we need to pick it up a notch. And this is where the definition of exercise comes in. So physical activity is using what you have. Exercise, which is planned, structured, repetitive, it has a purpose. This is forcing your body to tap into reserves. It's doing something your body's not comfortable doing. And it's something that if you were to do long term, it would destroy, right? You actually are degenerating or degrading resources when you're doing exercise. But when you time it and you allow time to recuperate and recover, it's this principle that's going to come up over and over again, is this 1 step back, 2 steps forward. 1 step back, 2 steps forward. Basically what exercise is it's exposure to levels of stimuli or stress the body's not accustomed to, and it's eliciting a chemical, a mechanical, and physiological agent for change. And your body gets stronger after it, right? And so this exercise, this is what tempers the body. This is what increases your stress threshold. This is what people need to be doing. Physical activity is great, right? This, as much as you can do, get off your butt, move around, but this is not going to make any changes. This is just going to preserve what you have. This is going to be the key. So again, you have to ask yourself, are you doing an activity you already can do? Like you go for a walk, right? Did you break a sweat? Were you tired? Were you exhausted? You probably stopped because you were bored, right? Or you had something else to do. Exercise, right? Think about how we manage your time. What we define as exercise loosely, something you're doing for minutes, right? 20 minutes, 30 minutes, 40 minutes. This is going to come up quite a bit. It comes up in this lecture and in the next lecture. The exercise is based around the Goldilocks principle. Not too much, not too little, just right, right? Exercise is a double-edged sword. If you don't do enough, it's a waste of time. It's like physical activity. Well, not a waste of time, but a waste of time for your goals. And if you do too much, you exceed the body's ability to recuperate, and you don't get any progress and results. So the reason why people drop out of the gym is that they're not seeing any results. Usually it's not seeing results, or they get hurt, right? Those are the two aspects. So what separates physical activity and exercise is this concept called intensity. And intensity is key. It's the key. Again, are you doing an activity your body already has the resources to do, or are you doing something that is pushing beyond what you comfortably can do? Right? That's the aspect. And that's why we get into this Goldilocks principle, is that we stimulate, not annihilate. It's not the just do it, it's the just right? Not too much, not too little, that perfect sweet spot. The enough intensity to elicit a change, but not exceed the body's ability to recuperate. And again, this is going to come up over and over again. This whole Goldilocks principles, this 2 steps back, 1 step forward. I'm sorry, just the opposite of that. 1 step back, 2 steps forward, and it's the appropriate stimuli to get the maximal progression, right? The shortest amount of time with the biggest bang for your buck. I mean, as a personal trainer, as a physical therapist, any type of movement specialist coach, the amount of value you can provide is how much results someone is getting. And in order to satisfy that, you have to do it in the shortest period of time possible without hurting your client or athlete. So that's the game you're playing. This intensity or this exercise recommendations is driven by the American Heart Association and the American College of Sports Medicine. And so they have these minimum guidelines, recommendations for physical activity. And that's when you see this PA here and here and here, that's referring to physical activity. And the guidelines here don't discriminate between physical activity and exercise like I shared in the previous slide. What they also don't do is they use this term aerobic, and what we'll learn is that aerobic and anaerobic are your processes for energy production, but your body's always in an aerobic state. And what we want to do when we get into this intensity is, are we going from aerobic to anaerobic type process? But we'll get to that. But the focus here is, when you look through this, and this is in your book and this is in the Blackboard shell, that you're doing one of 2 things. You're either doing 5 days a week of long, slow duration, so these are going for walks and jogs, or you're doing 3 days a week of like a HIIT type training, high intensity training. In addition to that, for your cardiovascular or your aerobic activity, which is really anaerobic, you're doing high intensity resistance training, which is the 8 to 12 repetitions, the lifting a load that's big enough to stimulate tissue and muscle and bone and connective tissue to make those tissues stronger as well. So that's it. Those are the recommendations for activity, and no one's hitting this, right? The small percent of the population. When you look at how many people in the United States, when they do these health surveys, are doing just physical activity, at least 30-40%. When you're looking at how many people are actually participating in high intensity exercise, 2 to 3%, single digit. That's it, right? So that is the key. It's this resistance exercise, this high intensity, whether it's resistance training or cardio, which is the same stuff. That's what's needed in order to prevent early death. That's what's needed to make your body resistant to disease and breakdown. And that's why we have such a rampant amount of this, is because people aren't doing that. Children need a little bit different, 3 days a week, but hopefully kids are off the frickin' iPads and outside playing. Unfortunately, not the case, but out playing all the time and just running around the park, involved in, hopefully not in organized sports, and unorganized play, so they can have dynamic exposure and not repetitive type aspect. That's what they need, right? So kids just need to get out and play, climb trees, run, chase each other, wrestle, throw things, catch things, ride bikes, fall, climb ropes, all that fun stuff. So when we look at this, let me back up one slide actually. When we look at this moderate intensity, this vigorous intensity, how you determine that is the big question, is how do we determine this? And the easiest way is on a 0 to 10 scale. And the 0 to 10 scales are used often in the health field. They use it for pain. So we usually say 0 is no pain, 10, enough pain like an animal's ripping your leg off, right? And then everything in between. And so we do the same thing for like how hard something is. Unfortunately, when someone's detrained or is just new, totally novice to exercise, they tend to overestimate. So for them to do a push-up, they'll say, oh, that was like a 9 or a 10. But that perceived aspect was really just because they're not accustomed to it. This tends to be a really appropriate scale, pretty accurate with intermediate to advanced. So this is one method that you can kind of tell. Give yourself this scale on a 0 to 10, and it correlates pretty well with your heart rate. And as we'll learn, heart rate, it's actually in the next unit, is a window into how hard the body is working. The working muscles are the biggest recipient of blood delivered resources, so oxygen and glucose. And the harder they are working, it really is the more demand for resources. The heart services the working muscles, thus it is a window into how much effort or intensity is required of the task. And so if you wanted to get a little bit more advanced, you would do heart rate training, or heart rate assessment. And as your exercise intensity increases, your heart rate's going to elevate to match the demand of these muscles. So from a stand to a walk to a jog to a run to a sprint. And this is where Orange Theory and Orange Theory Fitness comes from, is that you want that Goldilocks principle, not too much, not too little, just right. So instead of calling this orange, we should really call this gold. And as we'll get into in later slides, we'll revisit this whole effort versus effect. Different exercise intensities elicit different physiological responses and requires a certain amount of recovery. So when you're looking at your exercise programming, you are trying to affect most of these aspects. So in the end, when you look at the American Heart Association, American College of Sports Medicine, moderate intensity is a 5 to 6 on that 10-point scale, or heart rate that's in 50 to 60% of your max, or vigorous intensity, which is a 7 to 8 on the 10-point scale, or 70 to 80% of your max heart rate. So basically, are you breathing heavily, sweating, and rapid heart rate versus like this plateau? And our final slide here, we'll look at, this kind of shows the tiering of the exercise progression, that your physical activity should be the baseline stuff that you do every day. You don't include it as exercise. These are things that you should just be doing as part of your normal aspect. And then like the 3 to 5 times a week, getting these high intensity exercise sessions, plus your 2 days a week of resistance exercise minimum. And definitely not 5. If you're training more than 5 days a week and you're not an athlete and you're not a professional athlete or a movie star with a personal trainer, that's all you're doing, you are doing too much. You are Papa Bear, not Baby Bear. And if you're a competitive sport, that suffices for that vigorous aspect. So food guide pyramid sucks. Activity pyramid is pretty cool. So that's that for this. We'll carry on into this whole, how is intensity affecting our stress levels and how stress can then affect physiology.